I want to start by introducing our sponsors. So all of the logos that you see here are all of the people who have co-sponsored this event today. And the event we are doing is Our Health in Wildfire Season. And so we have 3 speakers for you. Each one will talk for about 15 minutes. And then at the very end of the program, we will have questions and answers. So feel free to type your questions into the question and answer box on Zoom or into the chat, and we will collect those questions and we will answer them at the end of the webinar. You can type your questions in English or Spanish. So my name is Damon Mott-Story, and I work with Oregon Physicians for Social Responsibility. It is my pleasure to present this webinar to you in the midst of Oregon's 3rd climate-fueled disaster in 9 months. I think it is really clear that we have to both be taking action to mitigate the climate crisis while also taking action to adapt to it. And so on that theme today, we will have 3 speakers who will talk a little bit about the health impacts of smoke from wildfires, what you can do to protect your own individual health, and what workers who work outside can do to protect their health. So without further ado, I'm going to introduce Elliot Gall, PhD from Portland State University, who's going to, oh, sorry, I think actually I got the order mixed up here. I think that Erica is starting with us off. My apologies. So it's my pleasure to introduce Dr. Erica Mosesen, who is a doctor at Legacy Emmanuel and who knows a whole lot about the impacts of wildfire smoke on our respiratory systems, and who is going to talk a little bit about the health impacts of wildfire smoke. So Erica, please feel free to turn on your video and start sharing your screen. Thank you for being here.
All right, thank you for having me. So you should be able to see my slides. Can everyone see? Okay.
Yes.
So thank you for inviting me. My name is Erica Mosesen. I'm a lung and ICU doctor. And then, well, my slides are not advancing. There we go. I have no financial disclosures. I'm a member of Legacy Medical Group, but I'm not speaking on their behalf. Similarly, I'm not speaking on behalf of the ALA, although they are obviously co-sponsoring today. So in 15 minutes, it's a bit of a tall order, but I'm going to do what I can. This is the overview of what we'll talk about. I'm going to talk a little bit on what we know and what we don't know and kind of what we're extrapolating in terms of health effects. I'll talk about composition of smoke, who are in the vulnerable groups we particularly worry about. I'm going to talk about short and long-term health effects, health protection during smoke events. I'm going to touch a little bit on respirators and talk about what we can be doing before and after smoke events for our health. So what we know and what we don't know. So the hard part is, we have started doing more research as a scientific community on the health effects of wildfire smoke, especially as these events are becoming bigger and more significant. And early data seems to show that there's similar effects when air pollution is from wildfire smoke and has certain components as from other kinds of pollution, but we don't know whether there's more effects or slightly different effects or what else might be happening that's unique for wildfire smoke. And then we actually need a lot more research on how to protect people from smoke. So we assume that reducing the pollution exposure and the particulate exposure will be protective, but we need more data on how best to do that and what are the main things to focus on. So mostly because smoke from burning biomass is complex, right? So, it probably also depends on what's burning, right? It's probably different if it's just trees burning versus, a gas station and cars and structural fires, as we're seeing when these things get into the urban areas. The 3 of the, pollutants of greatest concern that are regulated under the Clean Air Act that are, that happen in wildfire events are particulate matter, ground level ozone, and carbon monoxide. So ozone is actually a secondary pollutant that's formed kind of downstream in the smoke plume and has a lot of different health effects, especially on the respiratory system. Carbon monoxide is something that's more at risk in the immediate area of the fire. So, something that our firefighters might have to worry about more and then tends to fall off. And then PM 2.5 is something that I'll explain later. And that's generally the monitoring focus, the pollutant used to estimate health effects. And it's the place where I'm going to spend most of my time. So PM 2.5, particulate matter. Basically, most particulate matter that we monitor is sized. So when there's numbers around it, it has to do with the size. And the size matters because the smaller the particles are, the deeper they can penetrate into our body and cause problems. So big, even though it's still smaller than a human hair, particles like PM10 kind of hit us in the face. They kind of cause eye irritation, nose irritation, mouth irritation, throat irritation, and can cause, can make us cough and have symptoms. But the really deadly particles are the PM2.5, which is actually what is over 90% of wildfire particulate matter by some estimates. And those penetrate deep into the lungs and cross into the bloodstream in the lungs and can circulate all over, affecting our organs. So one of the things, kind of one of the easier ways to conceptualize this is thinking about the PM2.5 in terms of smoking, right? So, smoking cigarettes is kind of the original smoking and particulate matter disease, right? You're just inhaling smoke straight into your body. And, this is very imprecise, but some experts have done an analysis where they think that for every 22 microgram per meter cubed increase in the PM2.5 that we measure, it's kind of like the whole population of that area exposed to it decided to start smoking about a cigarette a day. So when you get your PM2.5 into this 400 range, it's like an entire population started smoking a pack a day. You have as much disease, death, that sort of thing. But this is an average, right? So for more vulnerable people, it may be that you have someone who it's like they're smoking 6 packs a day. And for someone else who's more protected and clean air or healthier, it's much lower. But like with cigarettes, the particulate matter effects, lung disease and cardiovascular damage and disease and death predominate in kind of both the short and long term, we think. As a kind of a reference, the American Thoracic Society recommends that you have a level for an average annual standard of below 11, or maybe even 8 with their most recent recs, but we'll see where that goes. The EPA is a little higher at 12. And also for a short-term acute exposure, like for 24 hours, to not be higher than 25. However, just so you know, kind of like with secondhand smoke, multiple studies have shown increased death rates and health effects even below these levels. So what are those effects, right? So even for healthy people in the short term, particulate matter is a respiratory irritant. So it can cause, wheeze, phlegm, trouble breathing, and also impacts the immune system of the lung with decreased clearance of viruses and bacteria. Not everyone's affected, right? And most people, if they're just healthy and they're exposed for a short time, are going to recover. You do see increasing ER visits, doctor visits, and death in vulnerable and sensitive groups, and likely increased premature deliveries. And probably one of the easiest, like the best things to understand is understanding who is more vulnerable to this and who are the, sensitive groups that we talk about. A lot of that has to do with life stage, and I'll explain why. So it kind of has to do with the dose you get related to your size. So children are really active, they're more active, they run around outside, and they actually just breathe more pollutants. They breathe more than adults per pound of body weight. So they're getting a higher dose. Pregnant women also breathe more, and they are likely have an increased risk of premature delivery and lower birth weight from particulate matter exposure. And then older adults, there's probably a higher burden of pre-existing illness, and there's just decreased resiliency to smoke effects with age. For people who already have lung disease like asthma and COPD, there's an increased risk of worsened lung function, hospitalization, and death. For people who already have heart disease or blood vessel disease, there's increased risk of heart attack, stroke, and death. And two other vulnerable groups are people in a lower socioeconomic status. So there's a thought that potentially there's an increased risk of undiagnosed or undertreated illness, but there's also, I think, a more chronic exposure to higher levels of particulate matter. And we know in people who have less resources are frequently kind of more chronically exposed to unhealthy air. So there's probably decreased resiliency there. And then outdoor workers, it's kind of like exercising and, prolonged exposure at high levels, increased exertion, inhaling more particulate matter. So I'm just going to touch on a couple of studies that actually looked at wildfire smoke exposure in particular. Following the 2007 California wildfires, there was a very large study of kind of Medi-Cal claims in California that showed a 34% increase in breathing problem visits to the ER and over 100% increase in visits for asthma in the 5 to 10 days following smoke exposure. And then just to kind of emphasize this life stage component, for 0 to 4-year-olds, these ER visits increased 70%, and it was over 200% for infants, for children under the age of 1, just kind of showing that dose effect on younger kids. But this kind of stayed prolonged, right? So people still had higher visits for bronchitis even after the air had cleared. And when the air quality index was unhealthy for sensitive groups, the next day you had a 73% increase in ER visits for breathing problems. And then similar to other studies of PM 2.5, like from diesel or traffic related air pollution, for every 10 microgram per meter cubed increase in PM 2.5, you had around an 8% increased risk of ER visits for asthma following. This is another study that looked, and so that's kind of talking about lung disease. So then heart disease. So after the 2015 to 2017 California wildfires, this study looked at the incidence of just dropping dead of a heart problem, right? So either probably a giant heart attack or a bad arrhythmia. So sudden cardiac death is where people, people just drop. And this, mostly happened out of the hospital, and then, ambulance services are called, et cetera. And so what they looked at was heavy, medium, and light smoke exposure. And so their heavy exposure was 22 micrograms per meter cubed. And as a reminder, this is technically below the ATS 24-hour standard of 25, medium, and then light. And you see, and then the lag. So day 0 was when the smoke happened, and then these are the days following. And you see that the risk of sudden cardiac death went up for the heavy smoke plume and less for the medium to light side of things. But after you'd been exposed to that higher level, there was this increased risk of death from heart disease. And so what about long-term effects, right? So all of us lived through this really prolonged smoke last fall. Like, what does that mean for us long-term? And this likely depends on the duration and intensity, and also, whether you're a member of a vulnerable group. So one thing that's a little helpful to look at is in 2017, in Montana, they had pretty severe wildfires, and one area called Seeley Lakes had, out of 35 out of 49 days in a row, they had severe, unhealthy air, averaging around 200 micrograms per meter cubed, but as over 600 at times, kind of like us last year, because they had an inversion just kind of trapping the smoke around the town. And the University of Montana went out and looked at lung function and in the following years and the flu season. And this is what they found. So here was 2017 was the smoke event where people were exposed. And this is kind of the normal lung function that you'd expect for men and women. And in the following year, in 2018 and 2019, people, even without lung disease necessarily, actually had decreased lung function in a pattern that could put them at risk for future obstructive lung disease. And then they didn't go back in 2020 because of COVID. But that's concerning. The other thing is the following winter, they actually had much more severe flu season in the areas that had higher levels of PM 2.5. And there's a lot of data suggesting that exposure to particulate matter does probably change our lung immune system, which obviously with the global pandemic is pretty concerning. So there's kind of trends in general with, things like viral infections like flu with particulate matter. Acute respiratory distress syndrome can be more severe in people who smoke, for example. And around 17% of the US COVID-19 mortality, the death from COVID-19 in the US, is actually attributed to this interaction with particulate matter and COVID. So what do you do during a smoke event to protect your health? Well, we think staying indoors is helpful, right? Decreasing your particulate exposure, and then also try to decrease the dose in other ways, right? So trying not to exercise, which can really increase our intake of the pollution. We also tend to breathe through our mouth with exercise, which kind of bypasses our nice little hair, filters in our nose. But exercise is good for you, right? And the mental health toll of these fires and being trapped inside is really high. So kind of where you make that balance is something that I still think we're not quite figuring out yet. But I'll just emphasize, if you can get to an area with acceptable air quality, like if you can make a good clean indoor air shelter, do some exercise indoors, or go do mall walkers, or find a place where you can get to clean air, that balance is important. If you're a member of a sensitive group, or a vulnerable group, or someone in your family is, if you've got family or relatives that are in clean air, it might be worth going and staying with them. Trying to minimize trips outdoors and combine them for just necessary items is also important. Other things to do is to actually be mindful of not generating extra pollution in your house, right? So cold prepping food, don't smoke, right? So it's crazy to be worried about PM 2.5 outside of 50 when you're sitting in your house smoking and raising the levels over 600 in your own home, right? So even things like candles, incense burning, vacuuming, kind of re-stirring up particles if you don't have a HEPA vacuum can be an issue too. And so just kind of being mindful of what you're doing, to your own indoor air, which I know Dr. Gall will be talking about. And then I'm going to touch briefly on respirators. So this is a really challenging issue because these weren't designed for wildfire smoke events, right? They were designed to be used by healthy workers in these like occupational, environments with like annual fit testing and everything. But on balance, people who study these things, NIOSH researchers, et cetera, think that probably the benefit of being able to decrease an individual's level to particulate matter exposure probably outweighs the risks. And the two risks I would worry about is that people, wear a respirator so they feel safe to just run around in the smoke, and that's all fine. But this focuses on particulate matter. It doesn't affect gas phase compounds. It doesn't affect a lot of other things. So I wouldn't like put on an N95 and go through it for a jog when the PM2.5 level is like 500. And then there's also the risk of like worsening heat stress or illness or something like that. When you're trying to wear these things for prolonged periods of activity. I mean, all of us who've worked in the ICU for the last year with COVID. I mean, even just indoors, it can wear on you after a while. But as part of a harm reduction strategy on balance, I think it's probably worth doing. So with the data I know, me personally, I use one. Like this is me grocery shopping last year when the PM2.5 was over 500. I'll use one as like a harm reduction approach, but kind of combined with everything else. So talk with your healthcare team. If you're going to get one, try to ensure appropriate sizing. If it's getting wet or damaged, just get rid of it. And just remind people that masks are not respirators, right? So just because something's got a metal bridge over it and looks like this doesn't actually make it a 95 mask, right? So a way to identify a respirator is you see that it'll usually say NIOSH on it. And then, but you usually want a 95 or higher, and just be aware that there are a lot of people selling things that actually aren't NIOSH certified. I can't say that they don't do something, but if you're going to go spend the money, I'd recommend actually looking up on the CDC. You can actually look up NIOSH approved particulate respirators. They have 2 tracks, one for medically approved and one for other. Either are probably fine. And so you can kind of see if what you're buying, has been looked at. And just making sure that you're fitting it correctly. There's plenty of resources on the CDC and NIOSH to make sure you're doing that. This is kind of just what it looks like from the side and the front. And so then what to do before wildfire season, right? So what I'd probably recommend is kind of get to know your airnow.gov website, as well as their fire and smoke maps. There's a lot of helpful links and PDFs on multiple topics, in case you forget this talk. And then talk to your doctor in advance about whether you may be a member of a vulnerable group, and figure out who in your family would be vulnerable, and kind of make plans for smoke events with them. I personally generally tell my patients who have lung disease to get 2 to 3 N95, NIOSH respirators that they, think are comfortable enough and know how to fit them. And then kind of make a plan for clean air space in your home, identify places that you can get clean air. Then some other practical tips are maintaining a several day supply of non-perishable groceries that don't require cooking and toasting or, that sort of thing. Again, quit smoking or vaping if you're doing that. If you have a chronic illness, making sure you have plenty of medicines. If you have asthma or COPD, have a written action plan and make sure you have plenty of controller and rescue medicines. Make sure you're up to date on your vaccines. So just remember that effect on the immune system with the lung. And then make sure you have flashlights to avoid candle burning if your power goes out. And so then after wildfire season, just be aware of your health, right? So if you've developed any new symptoms, seek consultation with your healthcare team. Just remember that living through a wildfire smoke season may have caused some health problems that are new, and hopefully addressing them early will be helpful. If you have chronic illness, try to bring it under the best control possible. Again, if you're smoking cigarettes or vaping, work to break free, and ensure you're up to date on vaccines. So remember the smoke effect of lungs on the immune system, like we talked about. So I'm hoping I'm coming in close on the 15 minutes. I have plenty of backup slides later if there's questions. So my take home points are, the health effects of smoke events are significant, but there are hopefully steps we can take to reduce the risk, even though we don't fully understand all the risks of wildfire smoke yet. So it's very important to prepare before smoke events. The people most at risk are the young, pregnant, elderly, and those with heart and lung disease. So know if you are a loved one or in a vulnerable group, and make specific plans for them in smoke events. So, before, during, and after smoke events, these plans can include clean air, food, medicine, water, respirators if needed, or you've decided to kind of do that. And just remember that the particular hazards of wildfire smoke, we're just kind of starting to understand them, right? So there's certain things like particulate matter that we have a deeper bench of understanding with, but there's probably some other hazards that we're not that familiar with, and they're going to be evolving. So just kind of understand that science and research is evolving, and kind of try to follow it as best you can. And then we're going to learn more about indoor air and outdoor work from our upcoming speakers. And I've got some more information on my website, and have a podcast that people can listen to for if they have other questions or want to reach out to me. So with that, I will pass it to Professor Gall. Oh, and I'm so sorry. I want to show this is for references just to have them in the webinar so people can kind of go back and pause and I can make these. These are a lot of the studies we went through if people want to look at them and everything. Okay. Thank you.
Thank you, Dr. Moseson. We so appreciate you. I'm going to switch the spotlight over to Elliot. And I just want to quickly tell people, do not worry. We will have all of these slides available in links attached to the YouTube video recording of this session. So you will be able to take a look through the slides on their own after the event as well. So thank you, Dr. Moseson. Next up, we have Elliot Gall, PhD, an assistant professor of engineering at Portland State, who will cover how smoke enters the home and ways to create a clean air shelter within your home, including different types of filters and air purifiers. Thank you so much, Elliot. Take it away.
Sure. Okay. Thank you very much, Damon, for that introduction. I'm really glad to be here and have the chance to share. I'm going to jump right into it in the interest of time, and I'm going to focus this talk on some strategies for creating a clean room in your home. Looking at a high level, the goals of this talk, in addition to that, I'll very briefly talk about what's in wood smoke and at what levels. Dr. Moseson did a great job covering that, so that'll be very brief. I want to cover how wood smoke enters a home before we think about how we control wood smoke levels in our home. Let's think about how wood smoke gets into our home. We'll talk about how to reduce wood smoke levels in a home and what level of intervention effectiveness we should be targeting to create a safe space inside our homes, a clean room inside our homes. And then we'll review a step-by-step strategy for creating a clean room inside your home. Wood smoke is a complex mixture. I want to reiterate that from what Dr. Moseson was saying. Can folks hear me?
Yes.
Okay, great. Sorry about that. I want to reiterate that wood smoke is a complex mixture that contains both particulate matter.
I'm sorry. I do think Maria froze, Elliot.
Yeah, so that's why I asked. I couldn't see Maria anymore.
Yeah, let's wait for just a second.
Okay.
Perdón. Un momentito. Melanie, I'm also going to pause the recording real quick.
Wood smoke is a complex mixture. Dr. Moseson mentioned that, and I want to reiterate some key points on that. Wood smoke is a mixture of particles and gases. Particles are what we refer to as solids or liquids suspended in air, often classified by size. We already heard about PM 2.5 as one of the most measured and important metrics for health that makes up this constituent of wood smoke. Wood smoke, the particles in wood smoke are complex. They vary in time as a function of source and environmental conditions. Wood smoke also contains gaseous pollutants. So these are things that are not particles. They're part of what we think of as the air around us. There are potentially hundreds to thousands.
I'm so sorry. I'm going to have to interrupt again where we lost the interpreter again. I'm so sorry.
No worries. Thank you.
Perdón a todos. Un momentito. Necesitamos un momentito. Okay, I got a text saying she's there. Can we try again?
Sure. I'll just pick up where I left off. Okay. So wood smoke is a complex mixture that is comprised of both particles and gases. We were talking about gases and how there are potentially hundreds to thousands of organic gases that are elevated in wood smoke, in addition to things like carbon monoxide, oxygen, oxides of nitrogen, and ozone. The key takeaways down at the bottom of the slide shown in blue is that both gaseous and particulate phase components of wood smoke are of health concern, and they might be elevated by a factor of 10 or as much as 50 times higher than normal conditions when a wildfire is not occurring. The distinction between a gas phase pollutant and a particle phase pollutant is important because to control a gas phase pollutant versus a particle phase pollutant requires different control methods. And to put it simply, we have better interventions for removing particles from air than gases. So in this talk, we'll focus on particles, but we'll also discuss gaseous pollutants as well. Let's think about how wood smoke enters a home. If you lived in Portland last summer, you probably experienced how wood smoke enters a home. And wood smoke enters a home by ventilation. So most residences, we'll focus this talk on residences, are ventilated through some combination of these three things: open windows or doors, which should be closed during a wildfire. Very rarely, your HVAC system, your home's heating, ventilation, and air conditioning system might have an outdoor air intake. During a wildfire event, that should be closed as well. And then infiltration, what you might think of as the leakage of outdoor air into your indoor environment. So if the first and second bullet point I'm showing there are closed intentionally during a wildfire, it's infiltration which acts as the source of wood smoke from outdoors to our indoor environments.
And I'm going to pause you there again because I think Maria's internet is having trouble.
Oh, that's too bad.
Momentito otra vez. Lo siento, lo siento. Oh, okay, I think we're good.
Okay, so the important takeaway from this slide is that infiltration or leakage of outdoor air into your indoor environment is the major source of wood smoke into your home during a wildfire event. And that assumes that you're keeping windows and doors closed. And if you're one of the rare few whose HVAC system in your home has an outdoor air intake, you have closed that off so you're not intentionally bringing in wood smoke during a wildfire event. How can we reduce levels of indoor wood smoke? There are really three methods we might think about undergoing. One would be to prevent wood smoke from entering the home by reducing infiltration. The second would be to introduce air cleaning into your indoor environment. And this could either be by placing a portable or standalone air cleaner into the occupied space of your home. Or if you have a central heating, ventilation, and air conditioning system, you might have a filter on the air handler of your central system. Either of those can be viable means of introducing air cleaning into your home. The third mechanism by which we might remove wood smoke is a process that's happening in the background of your space. Something like particle deposition, essentially the settling of particles to surfaces. And really what I want to focus on in this talk are 1 and 2, reducing infiltration and air cleaning. Deposition is happening constantly in the background, but it's quite difficult to enhance that loss mechanism, to accelerate the removal of particles by deposition. So we're going to focus in this talk on discussing air sealing and air cleaning as 2 interventions that we can think about using to our advantage to create a clean room in our homes. Let's frame the challenge. As I mentioned previously, we have outdoor particulate matter levels that are potentially 50 times or even more greater than normal. Our goal is to reduce indoor particulate matter concentrations to as close to normal levels as possible. So to create a clean room in our homes where, like Dr. Mosesen mentioned, maybe you can even, exercise or get some movement in during a wildfire event because it's a space with clean air. So in this talk, I'm going to come back to an example where we assume that outdoor concentrations of PM 2.5 are 300 micrograms per cubic meter. That was very consistently achieved during the wood smoke events of last year. Because of background removal mechanisms like deposition, staying indoors is generally protective. In my research lab, we use mass balance models to allow us to predict what's happening in an indoor space given a set of conditions. So absent any other intervention, you might expect a typical home with outdoor particle levels of 300 would have around 120 micrograms per cubic meter indoors. So staying indoors is protective. We have lower levels of PM 2.5. What we want to try and do, though, is get to here, the bar I'm showing in green, which is an ideal indoor concentration of PM 2.5 during a wildfire of something similar to non-wildfire conditions. Around 12 micrograms per cubic meter is the target that I've set for this talk. So if we think about
I'm sorry, I'm going to pause you one more time. I think Maria's video just paused again. I'm sorry, Elliot.
That's okay.
Lo siento a todos. Creo que la energética en muchos lugares no es muy bueno ahora. Lo siento. Okay, we're back.
Okay, so framing the goal, what we're trying to achieve here is this hypothetical situation of how can we go about realizing indoor PM concentrations during a wildfire period that are similar to that of what we experience under normal conditions. This simple calculation on the right here is showing to what extent we need to remove PM 2.5 from the indoor space. It's called the intervention effectiveness. Essentially, what we calculate is that we need to have 90% reduction in the indoor concentration of PM 2.5 during a wildfire to get those indoor levels back to what you might experience during a non-wildfire event. So the takeaway from this slide is that we're looking to intervene in an indoor space with effectiveness of particle removal of over 90%. Okay, so how do we do that? The idea here that we're going to talk about is to create a clean room in your home to protect your indoor air quality during a wildfire. This is one approach that the US EPA recommends, as well as the American Lung Association. The idea is that we want to set up a single zone in our home where we attempt to keep levels of wood smoke to as low as possible while we manage our indoor emissions. So I'm showing here a schematic of just a hypothetical home. And the idea is that we don't want to attempt to spread our resources too thin by targeting the entire home. Instead, we want to focus on a small zone in the home where we can magnify the effect of our interventions. So step one of our process in creating a clean room would be to focus our efforts on a small room. A bedroom is likely a good candidate. I would suggest something on the order of 100 to 200 square feet of floor area. We want to have fewer exterior windows if you have choices. Maybe think about having less exterior windows because those are a prominent source of leakage of outdoor air to the indoor environment. I think having one window is probably beneficial for psychological reasons though. We also want to have a door to the interior space. So why do we want to do this? Essentially, all other things being equal, targeting our interventions in a smaller volume means that they will be more effective. In the case of air cleaning, essentially, put that another way, a larger volume will require a larger air cleaner. Okay? If we have fewer windows, I already mentioned, that means less infiltration. And we'll talk about how we can use an interior door to achieve some interzonal mixing between our clean room and the rest of the home to manage emissions from indoor sources, namely the occupant, the person who's residing within this clean room. So once we have our zone specified, the next step would be to select an air cleaner. So sizing an air cleaner is a really important step, but it need not be complicated. I'd recommend looking for an air cleaner with a mechanical filter. Essentially look for phrases like HEPA.
Oh, I'm sorry, Elliot, I'm gonna pause you one more time. We've got another frozen window. I'm sorry.
Sure.
I think there's just a lot of intermittent internet. We had one of our panelists tonight, her internet went out right before we started. Okay, there we go. Go ahead.
Okay, so sizing an air cleaner is a really important step that need not be complicated. I'd recommend looking for an air cleaner that uses mechanical filtration as the mechanism of removing particles from air. So you can look for air cleaners that say something like HEPA, high efficiency particle arrestance filter, or something like a high MERV. MERV is another rating system that essentially measures the removal efficiency of a filter. I suggest avoiding what I'm calling additive air cleaners. These are things that have become very prominent and aggressively marketed in the last few years. Things like ionizers or radical or ozone generators. These haven't been tested under wildfire conditions and generally don't provide enough information for you to make a good sizing calculation in terms of their effectiveness. So to that, look for an air cleaner that reports what's called the clean air delivery rate. The clean air delivery rate is simply put the volume flow rate of air free of particles that are emanating from an air cleaner. Okay, so if you look at the sort of box of the air cleaner, you might see an image that looks something like this.
I'm sorry, I think we're gonna have to pause again. Let's take a little break. I heard from our interpreter that she's gonna call in on a phone call connection to try to make it a little more stable. So I'm gonna pause the recording.
Filter. These are two systems for evaluating the particle removal efficiency of a mechanical filter. I'd suggest avoiding what are called additive air cleaners, things like ionizers, radical generators, ozone generators. These are things that have not been tested and shown to be effective under wildfire conditions. Look for an air cleaner that reports the clean air delivery rate. The clean air delivery rate is simply the volume flow rate of air that is free of particles. And so the clean air delivery rate comes out of a test method called this AHAM. The Association of Home Appliance Manufacturers has a test method that essentially allows us to evaluate and compare air cleaners and to make these sizing calculations. So you might see a sticker like this on the side of an air cleaner you're looking to purchase. Look for the value present for smoke. That's the most similar particle that is tested that is relevant for wood smoke. And you can use that piece of information to ensure you're buying an air cleaner that's sized appropriately for your space. So AHAM has also developed a useful rule of thumb for sizing that's quite simple. It's shown here in blue. If you take the floor area of the zone you're looking to size an air cleaner in square feet, multiply by 2/3, that's the minimum clean air delivery rate you want to target. So a simple example, in the example we're going through, we're trying to develop a clean room for a 150 square foot bedroom. The 2/3 rule that it's called would require that we specify a 100 cubic feet per minute clean air delivery rate air cleaner and look for that for smoke. Okay, so it can be as simple as that. If you want to get a little more complex and try and think about specifying an air cleaner that addresses both particle phase air pollution and gaseous air pollution, things get a little bit more complicated. As I mentioned, to remove particles, which we have the more robust interventions for, focus on mechanical filtration. They're proven effective and studies have shown health improvements due to use of mechanical filtration air cleaners. So I'm just showing some pictures here of typical filters that might be present in an air cleaner or an HVAC system. For gases, we use sorbents. So you may have heard of a sorbent called activated carbon. And these are essentially compounds that either physically or chemically interact with the gas phase pollution present in wood smoke. They may be effective. Essentially, we have a very complex mixture of potentially hundreds to thousands of gases that are all interacting with this sorbent. In this case, I'm showing a granule of activated carbon. It's a very complex process. There's a lot of interactions that can occur. It's very hard to predict how well an activated carbon, for example, will perform in a given wood smoke plume, much less how long it will last. Because of that, there are less clear links to health improvements from sorbent-based gas phase air cleaning, but there are some studies that show it may be beneficial, and the underlying mechanism is sound. We're removing harmful gases from air, and so having an air cleaner with sorbents like activated carbon is certainly not going to hurt you, and it will probably help. Okay. If you're looking to include an air cleaner that has gas phase air cleaning capability, essentially what we have to guide our design are rules of thumb. So a common conservative rule of thumb for sizing an air cleaner to remove gases is to look for 4.5 pounds of sorbent per 1,000 cubic feet of volume in your zone, and then to replace that mass of carbon every year. So let's look at our example. In a 150 square foot clean room with 8-foot ceilings, we can use that rule of thumb and do some simple math and say we need 4.5 pounds of sorbent per 1,000 cubic feet of volume, and then we simply calculate our volume of our clean room, 150 square feet times 8. That gives us around 5.5 pounds of sorbent that we need to replace yearly. So you can certainly find an air cleaner on the market with this mass of sorbent like activated carbon. Usually they cost a little bit more upfront, and the filters might cost a little bit more. So I've done a simple 5-year calculation for just the material costs for the air cleaner and the filter. You're looking at about $1,200 just in material costs. And so really to conclude here, more research and more control strategies are needed to address these gas phase air pollutants during a wildfire, but activated carbon and other sorbents are really the best tool we have available to us if you're concerned about that. On the other end of the spectrum, looking at cost-effective means of reducing particulate matter levels in your clean room, there are some really great do-it-yourself options for combining a simple box fan with a household MERV 13 filter that you can get at Lowe's or Home Depot for around $20 a piece. So these can be very effective. Box fans move a lot of air, and MERV 13 filters do a pretty good job at removing wood smoke particles from air. I'm showing simply 2 different designs that were sort of shared widely on the internet during the Woodsmoke events last year. One is a little bit more expensive. It uses 5 filters to create a cube around a box fan. A simpler design is shown here on the right with a single filter that's attached to the inlet side of a box fan. This link here, Jim Rosenthal runs a website called Texair Filters, and he's done a lot of work on Twitter. He's sharing results of characterizations of these low-cost do-it-yourself air cleaners. So go to this link if you want more information on how to build one of these. Let's look at the impact of simply placing an air cleaner in a small room. So going back to our example of developing this clean room, we use a mass balance model to predict how well our interventions will perform in our 150 square foot bedroom where we're trying to develop a clean room. So in our example, remember, we're assuming that the outdoors is at 300 micrograms per cubic meter. Indoors, absent any intervention, any air cleaning intervention, remember, deposition of particles reduces levels of PM to around 120 micrograms per cubic meter. Simply placing our appropriately sized air cleaner in the space will reduce indoor PM 2.5 to 18 micrograms per cubic meter in the clean room, not in the entire home, just in the clean room. So even if you stopped here, you've done a substantial reduction in the PM 2.5 levels in your space. Okay. Now, 18 micrograms per cubic meter is still, relative to normal conditions, a fairly high indoor level of PM 2.5. So what are our options for increasing effectiveness? Well, there are 3 simple options we can think about. Option 1, purchase a larger air cleaner. More clean air is going to get introduced into your clean room. The upside is you have lower PM levels. The downside is cost and noise. Option 2 would be, instead of buying a larger air cleaner, buy 2 air cleaners. The upside here is, again, lower indoor PM levels, a smaller noise increase. Again, the downside being additional cost. Now you have 2 air cleaners to purchase and maintain. The third option, and the one that we'll talk about in a little more depth, is to seal your clean room, essentially reduce the infiltration or leakage of wood smoke into your clean room. The upside here is, again, lower indoor PM levels. It's very inexpensive, and there's no noise issues. The downside is that we can increase exposure to what we call metabolic bioeffluents, essentially carbon dioxide and other organic compounds that humans are constantly generating and emitting into the space, and can cause irritation, discomfort, degraded perceptions of the space. So we do want to try and address those, and we'll talk about that in a moment. Let's look at the upside, though, of reducing the infiltration of outdoor air into your clean room. So remember, this is temporary air sealing that I'm suggesting to try and reduce the infiltration of outdoor air into your clean room. This increases the effectiveness of your air cleaner because now your air cleaner is essentially competing against a smaller wood smoke source. We've reduced the amount of leakage of outdoor air into our clean room using something like a weatherization kit that's essentially simply a thin film of plastic and double-sided tape that you can use to seal around an exterior window. If your clean room is connected to the rest of the house via an HVAC supply and return, things are a little bit more complicated. There's not a single best answer in that case. You're welcome to reach out to me and I can try and help you think through it, but you may want to contact a professional in that case. Let's look at the benefit of adding air sealing to our clean room. In our 150 square foot clean room, now we have the same example as we looked at before with outdoors, indoors absent air cleaning. The green line is the indoor environment in the presence of an air cleaner. And now we've added this blue line, which is our prediction of what's happening in our clean room when we add air sealing in combination with the air cleaner. And what we see is that combination is quite effective. It's equivalent to adding essentially another air cleaner. We get a benefit of the equivalent of 70 CFM of additional clean air delivery rate. It's like adding another air cleaner to the space. And that happens with no noise at a cost of a few dollars per window, and you can take down that air sealing after the fire event ends. I mentioned that we humans are constantly emitting air pollutants into indoor environments. This is one of the major reasons why all buildings need to be ventilated. As Dr. Mosesen also mentioned, in the clean room and in your home, you should limit activities that generate air pollution. So cooking, cleaning, product use, take a break from all those things to the extent that you're able to. Obviously, our own emissions, we cannot turn them off. So we're constantly emitting carbon dioxide and these organic compounds that we call metabolic bioeffluents that I've already mentioned. In the building sciences and indoor air quality, we use carbon dioxide. So through our metabolism, we emit carbon dioxide, and that's a relatively easy thing to measure that we normally use as a proxy for our metabolics. So the question is, how can we manage our exposures to metabolic bioeffluents in our clean room, especially if we've done some air sealing to reduce that normally would be coming in to help push those out. So there are a lot of different strategies, and I'm going to talk about one of them. Essentially, it's a combination of two very simple things. One would be to take break space. This is really important, I think, for psychology as well. If you have one, wear and take from the space. Essentially, you're removing the source of indoor air pollution from your clean room, which is you, for a few minutes and taking a break from that confined space. The second option is we mentioned that we want an interior door on the clean room. And that's because we can use that door as sort of a damper to create an interzonal flow between your clean room and the rest of the house. And this allows a trade-off. You're essentially exhausting some of the accumulated metabolic bioeffluents from the clean room to the rest of the home. That's a good thing for your clean room. The trade-off is that you let in some of that higher particulate matter air from the rest of the home into the clean room. So let's look at one example. In this example, we keep the door open to 50%. So you have the door open halfway for 1 out of every 2 hours. That's what the orange line is showing there, up and down. The door's open, closed to halfway. The occupancy line shows that for 10 minutes out of every 2 hours, the occupancy in this clean room goes from 2 people to 0 people. And we see the impact of this on the top plot. This is a plot of the PM 2.5 concentration and the carbon dioxide concentration in the clean room. So we see the blue line shows our PM 2.5 levels. We start up the air cleaner, we start up our clean room, levels rapidly fall off. At 1 hour, we open the door to exhaust some of the bioeffluents that are accumulating. So we see in the gray line, the CO2 level increases when people enter the clean room. Then we open the door, CO2 tapers off a bit, but PM 2.5 rises a little bit, and so on and so forth. Then the two people leave the space, CO2 drops, and PM 2.5 stays the same because the door is open. So essentially, this is just one solution for using these two simple strategies to find a trade-off between these two things: exposure to metabolic bioeffluents and exposure to PM 2.5. So in this example, we have a CO2 exposure of 1800 ppm or so, and a PM 2.5 exposure of 17 micrograms per cubic meter. So we sort of found a balance between those two things. What can really help with that in terms of finding this balance is if you're able to invest in air monitors. And again, I realize this is an additional cost, but for some people, this might be something that's interesting and something they're willing to invest in. There are relatively low-cost monitors that you can use to evaluate the performance of your clean room. The first that I'd recommend would be to look for a particle monitor to measure the level of this particulate matter that is of primary concern to human health. I'd look for what's called an optical particle sensor, and I'm providing a link here to a news report from some testing done by the Lawrence Berkeley Laboratory, where you can get some recommendations. I'm showing one sensor here called the Purple Air PA2. That might be one you consider. You can look for outdoor data and figure out what's happening in your environment, either via a map that's provided by Purple Air or from the Oregon Department for Environmental Quality. You can do some simple calculations that will allow you to evaluate the effectiveness of interventions in your space, essentially calculating the ratio of the indoor PM to the outdoor PM with and without your interventions like your air cleaner running. Compare those two things, and you can get an idea of how effective your intervention is. The second monitor you might consider is a carbon dioxide monitor to measure those bioeffluents. During non-wildfire conditions, we generally, as sort of indoor air quality scientists or building scientists, we look to keep buildings below 800 ppm. During a wildfire, if we're talking about a residence where there are COVID concerns, that target is likely going to be much higher because, again, exposure to these metabolic bioeffluents is of secondary concern compared to the wood smoke exposure. If you're interested in monitoring carbon dioxide, I'd look for what's called a non-dispersive infrared CO2 monitor. And I'm showing one example here of a monitor that you might consider. Okay, so I'll wrap up there. I appreciate it. I should have mentioned earlier, I'm just going to slide back here, that the step-by-step discussion of how you might go about creating a clean room. There's a link to a blog post on Medium where I go through this in more detail, and you can peruse it at your leisure if you go to this link right here. Okay, it's on a few of the different slides that you can find. So I want to thank the organizers. I want to thank the interpreter for your valiant efforts. I appreciate it, and thank you for your attention.
Wonderful. Thank you, Elliot. And our final presenter is Ira Cuello Martinez, Policy Climate Association for PECUN, Pineros y Campesinos Unidos del Noroeste. That's the Northwest Tree Planters and Farm Workers Union, who will cover how outdoor workers can take measures to minimize exposure to dangerous smoky conditions. And I just want to let you know that we will be sharing email addresses for our panelists so that we can take some more questions without going too late this evening. So we'll try to do that. And we're also collecting the questions that people have already been sharing. Thank you. Okay, take it away, Ira.
Awesome. Thank you so much for the introduction and invitation to this evening's webinar. Hi, everyone. My name is Martin, Oregon Worker Union. Before our presentation, I am not a health expert. I am a labor and environmental justice advocate. I'm working really closely on the issues and want to bring some information around the approval process that is underway and the efforts to have protection for workers. But before we get started, I'll give a brief overview of who we are at Picun and our mission. So our mission is to empower farm workers and working Latinx families in Oregon through community building organizing, by increasing Latinx representation in elections, and through policy advocacy on both the national and state levels. Picun is based in the heart of Oregon, the Oregon Latinx community, and one of the most vibrant agricultural areas in the state. We're Oregon's farm union, and we fight for low-wage workers and Latinx families. We envision an Oregon where farm workers and Latinx families are empowered and have a say in the decisions that affect their lives in the workplace, as well as the communities where they live. And I also wanted to share some cultures from labor camps for farm workers that were in the 90s, and which to this ag and labor camps are still used to this day. And as you may imagine, they are also impacted by the wildfire smoke that we've seen over the last several years. Just some quick overview of farm worker statistics here in Oregon. Approximately 87,000 farm workers in the state, which includes both hand harvest and field workers. 40% of those workers speak an indigenous language, which include Mam, Bajo, Mixteco, Alto, and Zapoteco. 70% of farm workers are estimated to be undocumented. 59,000 are seasonal farm workers, while 29,000 are migrant farm workers. So the majority of farm workers in the state do stay in Oregon. And the most heavily populated farm worker counties include Wasco County, Marion County, and Hood River County. And today I wanted to focus on Governor Brown's Executive Order 04, which was signed on March 10th of last year, a week prior to the pandemic. So it was quite a time for this to all go down. But this executive order included a directive to the Oregon Health Authority as well as Oregon OSHA to jointly develop a proposal for standards and protect employees from workplace exposures to both excessive heat, as we experienced over this last weekend, and wildfire smoke, as we've seen in September of last year. So currently, Oregon OSHA is in collaboration with OHA, advisory and stakeholders who are working towards developing these two separate proposals, and Picun is heavily involved in these rulemaking processes. These rules were scheduled to be finalized in June, at the end of June this year. However, due to the pandemic, the deadline was actually extended towards the end of September, and which is kind of a concern for us as we are facing extreme weather conditions at the moment, yet we have the adequate protection for workers as we speak. Why is it important to protect health? Well, I just wanted to quickly highlight, according to the American Lung Association, 21.5% of America's workforce already suffer from asthma attacks at work, and 1 in 6 adult onset asthma cases are caused by occupational exposures, such as fire smoke. And when the AQI, or the air quality index, values are above 101, air quality is unhealthy for populations, as was described earlier by Dr. Erica. And these illnesses range, these sensitive populations range for folks with asthma, respiratory illness, heart or lung disease, and pregnancy. I also here, which explains a little bit around the populations and what level of AQIs are unhealthy for folks to be exposed to, as this will give context for information I'm going to share in the upcoming slides. It becomes unhealthy air quality for folks once it hits 101, particularly for those sensitive groups. It hits 151, it's unhealthy for everyone. And as we've seen in, again, last year's wildfires, where we saw 100, which is very hazardous for folks to be outside in. So as we're going this rulemaking process, one of the first things that we're asking employers and, for instance, farm owners to keep in mind is that they must determine and monitor the employee's exposure to PM 2.5 levels for each workplace when there's wildfire smoke present at the start of each shift. And we also want them to keep track of these AQI levels throughout the shift for a minimum of 3 times during an 8-hour shift, which include one check every 3 hours, one every 3 hours. And due to AQI's levels subject to change based on the wind, speed, and direction, workers working in remote locations where weather data cannot be easily accessed should be provided with some air sensors and know how to use those air sensors to understand what the next steps are in order to protect one's health when there's wildfire smoke present. As mentioned earlier as well, N95 respirators are the most effective when trying to protect one's health from wildfire smoke. And they also have to be NIOSH approved N95 respirators. And what we've worked with rulemakings is that the employers have to provide these masks, especially when the place reaches above 101 AQI level. The employer must also develop and implement a system for communicating the wildfire smoke hazards before employees are exposed to 101 AQI levels. And from the advocate's perspective, we believe that OSHA should mandate use at 101 threshold for all workers opposed to having employers encourage the use, as opposed to having the encourage the use. And we ask for this because there's often a lot of stigma associated with protecting one's health, and especially as someone who is a younger adult who may feel invincible from exposure to wildfire smoke or other workplace conditions. They might not feel the immediate effects. However, we understand they also have long-term effects on one's health. And so we really want to encourage an environment where one's own health is prioritized over trying to be as productive as possible in the workplace. I also want to acknowledge that we become more to use an N95 respirator, and as was mentioned earlier, they're not meant to be used for exercises or work, more to be protected for special occupational use. And when considering farm work, one has to pick and harvest as much of the crops as possible, and it becomes a risk and another concern for us as advocates as well, where we're communicating with both the farm workers as well as public health experts around possible solutions for navigating wildfire smoke in the workplace. Training is crucial for the rulemakings that we advocate for. So we are asking for an annual supervisor and employee employees and supervisors getting and fitted for the N95 mask on a rolling basis as they start work, and that employers document how the PM2.5 concentration in ambient air is monitored in a 24-hour period. These training opportunities must take during paid time, and attendance must be mandatory for all workers who may be exposed to wildfire smoke, which would include all outdoor workers. Trainings should also emphasize the prohibition against retaliation for workers who raise safety concerns. And this is a huge deal for farm workers because there's a lot of cases where workers may bring issues or concerns to the employer, however, they're met with hostility or even be fired on the spot for advocating for their rights. And this is something we do not want to see happen in the workplace when someone's trying to look after their own health. However, the employers may take it out on the workers who are advocating for themselves. We also want to information about clinics or medical facilities that are to the employees near the workplace. One thing I do want to add as well is, as I mentioned earlier, about 7% of farmers are adopted, and they also do not have access to healthcare. So it's a huge concern for workers to again be exposed to these workplace conditions and not having adequate health care or medical treatment needed to address any issues that come up as a result. Lastly, I also want to talk about work cancellation. Shifts that can be flexible during smoke should be shortened or moved to different times to limit exposure, and workers that can be physically relocated from a smoky workplace to a safer place must be transferred immediately. After levels becomes very unhealthy for folks. No one should be outside when AQI levels reach 500 plus, as we saw last year. And as you can see in this photo, the AQI levels were well beyond 500 and workers continue to harvesting crops. And we don't believe that this should be the case. Any worker, regardless of their occupation or industry, be outside when AQI levels are 500 or bright red. And they have to risk their health by inhaling all of the wildfire smoke. And we also believe that OSHA should require the maintenance of wages and benefits when employees need to avoid an unhealthy workplace work due to the health impact from smoke or heat. This is another area where farm workers are one of the least paid workers across the country, and they really afford to miss work. They continue working despite the weather conditions out of necessity to pay for their living expenses. And if we have a system or fund in place for workers to opt out of working under these extreme weather events and prioritizing their own health, that's something we want to see also implemented in the rulemaking process that Oregon OSHA is currently leading. So where are we at right now? Labor, climate, and public health advocates have submitted comments to Oregon OSHA regarding the latest version of draft rules on June 9th, which was earlier this month. We, at the bare minimum, we are asking for emergency rules to be adopted ahead of this year's wildfire season as it worsens, and as well as for the heat that we're currently experiencing. So there's a lot of concerns for how employers, ranchers, farm owners are handling the situation when it comes to wildfire smoke or excessive heat. And these emergency rules would allow all employers to have the same guidance, as well as workers to know what their rights and what rules are in place for them to advocate themselves for. It's very often the case that workers move from farm to farm or ranch to ranch, depending on the type of work. And we want to make sure that the rules are all the same regardless of which farm they go to, and without causing a lot of confusion within our community members. At the very least, for this year's wildfire season, we ask that all employers should have N95 respirators available for all outdoor workers. Last year, it was a case where these respirators were out of stock. They were sold out, and many workers continued harvesting the crops with their cloth mask, with their medical mask, which are not near sufficient to protect their health and their well-being. Bakun, along with these climate and public health advocates, are part of this larger Oregon Action Plan coalition, which is the logo that you see here to your right, and continue advocating for rules, permanent rules, as well as emergency rules to be in place for this year's wildfire season and for the years to come, as we anticipate more intense and frequent wildfires, hotter summers, more droughts, and just drier conditions in the future summers to come. So these are just a few areas to highlight. And if there's questions, again, Damon said that you can email directly either to myself or any of the health experts who presented earlier. I really appreciate everyone's time, and I will kick it back to Damon.
Thank you so much, Ira, and thank you to all of our presenters. For the sake of time, I'm going to suggest that we go ahead and finish. I know there are multiple working parents on the webinar tonight, so please put in the chat some thank yous and some applause for our presenters, and for our amazing interpreter, Maria, powering through despite disconnections. Thank you, thank you, thank you, thank you. And we appreciate everyone's attention and our experts. And Ira, you may not be a health professional, but you are an expert on worker health and safety. So to thank you very much to all of our experts. And I appreciate you taking time to be with us. And once again, to repeat, we have captured all of the questions that you have put into the chat and into the question and answer box. And we will share those with the presenters and get answers typed out. And we will send those answers out to everybody who registered for this webinar so that your questions will be answered. So that way we can be respectful of your time tonight and also still get you answers. So, and you can feel free to send additional questions to our presenters. I shared their email addresses in the chat. So thank you again. I'm going to put the YouTube link into the chat. That is the location where the recording for this video in English and in Spanish will be posted in the next few days. So thank you very much, everybody. To our presenters, feel free to unmute yourself and say good night.
Thank you very much. Good night, everyone.
Good night. Stop smoking if you smoke.
Okay. Thank you very much, everybody. Good night.